important to empower patients because they need to be, if you're not going to be your own advocate, who will be? Again, oftentimes patients know more than providers. How I counsel patients to be their own advocates is to give them information. So the more they know, I think knowledge is being empowered, and so I like to educate patients on what their risks are, what the right questions to ask are, what the answers to those questions are for those specific patients. And in particular for gastric cancer, I think the important things to know are, what are my risks, and that's based not just on ethnicity, but history of H. pylori infection, what your diet is, family history, genetics. Um, this has been extensively studied, and so we know what risk factors are, and I think that's how I empower patients is to inform them what their risks are, and what needs to be done moving forward in order to decrease their risk of developing gastric cancer, or at least identifying gastric cancer if they were to get it at an early stage where it is still curable. And I would say the take home message right now is that gastric cancer is curable, but we have to detect it at an early stage. And not only is it curable, it's curable without surgery. We can cure gastric cancer by an endoscopic procedure called endoscopic submucosal dissection if we can identify it early enough. And so we need to do a better job at diagnosing gastric cancer early. There are precursor lesions to gastric cancer so that we can survey patients who are at high risk. It's very similar to Barrett's esophagus, and Barrett's esophagus as the precursor lesion, then going on to dysplasia to cancer. And so, we all know that we should be surveying patients with Barrett's esophagus. The similar condition in gastric cancer is gastrointestinal metaplasia, but I get sent a ton of patients because providers aren't sure how to manage this. And so I think we have to have a better understanding on how to manage gastrointestinal metaplasia, what the risks of developing gastric cancer are, and knowing that we can cure gastric cancer if it's diagnosed at an early stage.